Hey guys, Chris Lindley with Vail Health, Chief Population Health Officer. I'm looking at an article that came out last week from the New York Times that had some really interesting data I wanted to share with you because it has some big takeaways. First, when we're looking at the last year, 2020, compared to the last 100 years of death mortality data, we can clearly see the impact that COVID-19 has had. In fact, over the last year, it's increased our excess mortality in this country by 16%. So that's looking at all-cause mortality in this country has increased by 16% in just 1 year. The second highest increase ever in the last 100 years has been the 1918 Spanish flu, and that was just 12%. So we know this last year has had a significant impact on our overall health and our overall mortality. So if there's anybody out there still on the fence about the need to get a vaccine, that this is all a hoax, I mean, this is as clear as evidence, as you can see. If you haven't already lost some loved ones, like many of us have, go out, get your vaccine, get protected. Let's move back to normal. What's also fascinating about this article is it looks at the leading causes of death in the United States. And I was actually really surprised to see this because even though COVID in this last year has caused an increase in mortality of 16%, still last year, the leading causes of death in this country was heart disease and cancer, followed by COVID was the third. But still, heart disease and cancer were still our two leading causes of death. And actually looking back the last 10, 15, 20 years, those continue to be the leading causes of death. And that's why it's so important for us all to take our overall health and wellness so seriously. For both heart disease and cancer, both of these are, for the most part, lifestyle-related diseases that we can, in fact, have some impact on by having a healthy lifestyle, eating right, moving, and having a life where we can try to do as little stress-induced behaviors as we can. Now that's a catch-22 because everything in our life, from being attached to our cell phones to screen time, all increases our stress. But we know that stress is bad. We know poor nutrition is bad, and we know lack of movement is bad. But those are all three things that we can all work on. What's also interesting when you look at what really caused the most death in our country amongst the folks that actually had COVID-19, it's the same things that lead to heart disease. Poor nutrition, those that were obese, overweight. Type 2 diabetics, which is a lifestyle disease that is caused by sedentary lifestyle and poor nutrition. And then underlying chronic health conditions like coronary heart disease, which, as you can see, is one of the leading causes of death. So again, just want to remind everybody that if you're looking for what to do as we go into this next year, a fresh start after the last tough year, focus on your health, focus on your movement, focus on your overall stress. Not only will you be better prepared should you get COVID-19, but you'll also be better prepared for the two leading causes of death in this country, which are heart disease and cancer.